a famous guru tells about a combination of neem and turmeric taken with tepid water early in the morning helps increasing Ojas. What is your view on this, and can everyone use this combination? So neem and turmeric every day, is it allowed, or should only be few people taking it? Sir?
It should be taken on doctor's advice. It is not a blanket advice that everybody go on taking it. So if you continuously take in that fashion, some of the Pitta Prakriti persons may develop some sort of allergies or rashes or even some other conditions related with the stomach. It should not be. And it should not be the same thing throughout the 365 days of a year. So we need to, according to the season, Agni Bala, and the person's nature, everything, we should analyze and then take it. Otherwise, in general termination, turmeric and neem definitely improves the immunity of a person, but doesn't mean that everybody using throughout the year may get the immunity. Immunity is not just by using some herbs we will get it. Immunity comes by many ways of life practices. It may be getting up early in the morning and doing vyayama and doing yoga, then practicing dhyana, and as well as eating good type of foods, and then taking these type of antioxidants and immunity builders. So such type of entire things of activities are collectively helpful for the improvement of the acquired immunity. It doesn't mean that simply you do nonsense throughout the day and one fine day morning you start taking this one neem and turmeric and everything will become settled. No, that is not the right way of thinking. That it is not suitable for everybody to take it. So there should be some Kafaja Prakriti persons, then they can take it. But while taking it in summer, it should be caution. Dose should be reduced. So like this, there are plenty of issues connected with that. It is not simply just mixing these two and taking it every day. It may not be a right one.
And also, like Ojas improvement or immunity improvement concept is so very personalized. It differs from person to person, and also depends a lot on the underlying condition. Of course, for a patient, person with diabetes, this can work. But like you said, exercise, mental calmness, stress levels, nutrition, all those things are so very important. And Ojas, the concept of Ojas also depends on how to improve Ojas in a particular patient. Also depends largely on the underlying disease also, sir.
Definitely, Ojas is such a thing. When you see a person on his face, there should be glitter and there should be some healthy status and should look good of these things and define the age. For example, if a person aged about 75 looks like a 50, then it's a good thing. So such things are due to the Ojas. But unfortunately, fortunately, we don't have any tools to measure Ojas. So it is very difficult to say that by giving some medicine, Ojas will increase. But it is a cumulative one and it is a continuously done process. It is not so. So it is a part and parcel of a way of living, and including all these factors, nutrition, sleep, avoiding the stress, and so many factors are there. Then definitely it will increase the Ojas as well as it will improve the immunity. But doesn't mean that simply taking these two things will improve the immunity. It becomes a part of it, but may not be the total thing.
Generally, the herbs which are explained as Rasayanas are a better way to approach boosting immunity for already healthy people like Amla or Chawamprash, etc. sir.
See, there are certain drugs which are the very potent actions are there. For example, Haritaki Patyanam, it is said. Haritaki is one such Rasayana Dravya. Even though it has 5 rasas in it, it is Kashaya Pradhana, but it is Ushna in nature, and its Vipaka is something different. So this type of drug we call it as Vichitra Pratyarabdha Dravya. So anything which is not fall in the similar line, and it is a Vichitra Pratyarabdha Dravya, and such drugs do act as Rasayana. But their result out of their activity is cannot be measured in a very typical manner, or it is not expected as such. But there are certain issues related with that. For example, if you want to go for a Rasayana therapy, then a drug should be taken according to the need of the person. See, first we need, when a patient comes to us, we need to assess the dhatu levels to some extent, how the dhatu sar lakshanas are there or not. So based on that dhatu sar lakshana, if any of the dhatu you feel there is some lacuna or there is a less or the low variety, low grade, then you try to select such a drug which is Rasayana in nature, but also has a very good influence on that particular tissue, dhatu. Then the result will be very good. So like that, we need to select the drugs. So simply say every Rasayana may not be giving you the exact type of results in every patient. So it is a variegated one. So generally, Amalaki is well tolerated among all the people, all type of people. Similarly, Guduchi, then Haritaki to some extent, Ashwagandha to some extent, Shatavari is very good one, Rasayana. Whenever there is you want to go for Rasayana, Shatavari is one of the best drug and Gokshura is also another one. So these type of selection should be there. When a person you feel that there is a Shukradhatu Kshaya, Shukradhatu something related with that and disease of the Shukradhatu, Shukravasrotas, then try to select Shatavari, Gokshura, Shilajatu. These are the good type of Rasayana Dravyas in that particular field. If a person having any problem related with the menstruation and reproductive system and in case of a female, then once again select these three. This is good. You can avoid even some patients, Shilajatu. So this is the way we need to assess the thing when a patient comes to us. Then accordingly we need to select a type of Rasayana Dravya which is most suitable to this condition.